Good morning, gang. Thank you for watching this video. I work very hard to bring it to you, and I thoroughly enjoy it. I'm getting ready to tutor somebody in just about a half hour, so I'm trying to get this together for the gentleman that I'm tutoring. But I'm not sure how to go about presenting this to you. I don't know whether to talk on the video or to put it on the screen so you can see it. But what I do want to do is I know I want to talk about the clinical judgment model. I think I'll recap it. Let me go ahead and put all that I've written here up on the screen for you. I think you'll appreciate that. You could possibly see it better, and please take notes, okay? Okay, let's review what we have learned so far. I want to go over the clinical judgment model simplified. I want to go over the way I taught you how to pick out the topic, the subject, and the action. And then I want to review the diagnosis, symptom, action. So there's potentially 3 ways to attack these SATA questions, or any NCLEX question for that matter. So let's get started. Remember what I said about recognizing cues, right? Recognizing what's important in the question. You look at the medical history, the vital signs, the lab work, the objective data, the subjective data, whatever it may be. What information is important, what information is relevant, and what information is of immediate concern. This is how we recognize cues. After we've collected our cues, then we have to organize the cues, right? Let's not forget, this is the NCLEX. So for some reason, the NCLEX test writers like to put stuff in there that has nothing to do with the question. So while it may be a cue, the second step you have to do is you have to analyze those cues, organize those cues. What conditions are consistent with the cues? Are there cues that support or contraindicate a particular condition, right? Prioritize those cues. Some of those cues may have nothing to do with the question. Be careful about that, okay? So what information, remember, what information would help establish the validity of the cue? If the cue has nothing to do with what the question is asking us to answer, then don't bother with it. Throw that cue out. Step 4 is generating solutions. Be sure solutions generate interventions based on relevant cues. Now, when you're thinking about solutions, you want to remember and think, what is the desired end result? What interventions can achieve the end result? What interventions can achieve what the question is asking, right? And make sure you realize what should be avoided. When generating solutions, you want to focus on goals that are connected to the intervention that the NCLEX is asking us to do. Correct understanding of the teaching, whatever the question is asking us to do, make sure that the solution is connected to the intervention. When answering the NCLEX questions, we're always taking action, all right? So when you take action, you want to implement the solutions that address the intervention. Which intervention is most appropriate? How should the intervention be accomplished? Think about these things. The NCLEX the answers will often be performed, requested, administered, communicated, taught, documented, included in the care plan. See, these are all taking action. So when you take action, make sure
that the solutions are part of the cues that are relevant to the question. I'm going to go over this. I'm going to go over this today with a question. This is called the clinical judgment model, and I'm going to teach you how to use this model. At the end of your NCLEX questions right now, those research questions that you have to answer at the end of your exam, use the clinical judgment model, and that's why they're so difficult. I know you're tired, you don't want to answer those questions, but the reason they're so hard is because the NCLEX is testing this clinical judgment model, which they will be implementing in its entirety in starting 2022. So I'm preparing you now. I really think they're using it now and they're just not telling you. And you'll see how it'll be so much easier to answer the questions if you just start thinking and using this clinical judgment model. The last step in the judgment model is evaluation of outcomes. This is especially good when we pick evaluation answers. You want your interventions to point to improving, declining, or unchanged status. Here you want to say to yourself, were the interventions effective? Focus on the effectiveness of interventions. So, to summarize, the 5 steps of the judgment model is to recognize the cues. Then you analyze the cues. Based on those cues, you want to generate solutions. Based on your solutions, you want to take action. And then when all of that is said and done, you want to evaluate your outcomes. All right. Now let's go on to the other 2 ways I taught you how to answer SATA questions. But make sure you know and understand how to answer questions using this judgment model approach. Remember that I told you guys you could pick out the topic and the subject in a couple videos ago. Write down 3 to 5 things you know about the topic. Write down 3 to 5 things you know about the subject. And then take action based on the topic and the subject. But I really want you to get in the practice of using this clinical judgment model. And then you could always answer it by writing 3 things about the diagnosis. Should the diagnosis be present, write 3 things about the symptom, and then take action, answer the question based on the things that you wrote down about the diagnosis and the symptom. Now, let's get to a question, and I will teach you how to use the clinical judgment model using a couple of questions.
The Next Generation NCLEX project, also known as NGN, began with development of an operational definition of nursing clinical judgment, or CJ. CJ is defined as the observed outcome of critical thinking and decision making. It is an iterative process that uses nursing knowledge to observe and assess presenting situations, identify a prioritized client concern, and generate the best possible evidence-based solutions in order to deliver safe client care.
This is why I told you to recognize the cues, analyze the cues, generate solutions, take action, and evaluate whether you answered the question correctly.
NCSBN brought together experts from measurement, test content, and technology fields to imagine item prototypes that could potentially measure CJ. This collaboration...
I'll tell you what, let's stop this and do some questions right now. I'll go over a couple questions. The first question is, which information should the nurse include when developing a teaching plan for a client newly diagnosed with type 2 diabetes mellitus? Select all that apply. Now we are developing a teaching plan, so we know that we have to apply the 5th step, evaluating outcomes. In evaluating outcomes, we want to, what signs point to improving the client's status, right? So that's what we're looking for. We're looking for answers that will improve the client's status. Keeping in mind that were our answer choices effective? All right, so let's look at the answer choices. So these are my choices for the select all that apply. Now what we're doing here is we're evaluating outcomes. We want to pick the answers that point to improving their status as a client. And we always want to keep in mind, were these interventions effective? So a major factor for complications is obesity and central abdominal obesity. This is true. I'm going to pick this because if I tell the client this information and they lose weight, this will be good for their health. This will improve their status. So when you evaluate the outcomes, and we know this is evaluating outcomes because we are including this in a teaching plan, right? So A is a proper choice. B, supplemental insulin is mandatory for controlling the disease. Well, it's not mandatory. If they change their diet and exercise, they may not be diabetic at all with type 2 diabetes, right? And if you change your lifestyle, sometimes you can reverse the diabetes. So I'm not going to pick choice 2. Exercise increases insulin resistance. Well, we all know this is not true, so I'm not going to pick this as a choice. And the primary nutritional source requiring monitoring in the diet is carbohydrates. That's not true. There's other nutritional sources. So if I told them this would not necessarily improve their status. So don't pick it. Annual eye and foot examinations are recommended by the American and Canadian Diabetes Association. This is a true statement. And if they actually went and to the foot doctor and the eye doctor every year, this would improve their status as a client, as a human being. So this is a true statement, so I'm going to pick it. So the two choices that are correct are A and E. The reason the question says Canadian Diabetes Association is because now people in Canada, nurses in Canada, also take the NCLEX. Very good. So the choices here were A and E. Okay, the next question, we're going to recognize and analyze cues, right? So the nurse is planning care for a client who chews the fingers constantly. Before applying mittens, the nurse should try which of the following interventions. Select all that apply. Now let's look at these questions and identify our cues. Now look at this question. It has the word interventions, right? So not only do we want to pick out cues, but we have to also remember that the solutions that we come up with achieve the end result. So remember, what interventions achieve the end result? So first, let's look at our cues. What cues do we have in this question? The nurse is planning care for a client who chews the fingers. Okay, that's a cue. Constantly might be another cue. Before applying mitten restraints, that's a cue. The nurse should first try which of the following interventions? There's no first there. I read the question that way. So what are our cues? Choose the fingers constantly. Apply mitten restraints. Those are our cues. Now, what possible solutions can we come up with? Our solutions should point to interventions. What do we need a solution for? Well, we're trying not to apply the mitten restraints, right? What else do you think we need? What is our end result? Our end result is, why do they chew the fingers? So that would be anxiety. So our end result is to have decreased anxiety and to not apply the mittens. This is what our solutions should point to. This is what our interventions should
Choice A.
consist
Ask
of.
the client to rub lotion
Right,
over
let's
the hands
solve
every
this
day
puzzle.
after bathing. How is this addressing their need not to apply the mittens? How is this addressing their anxiety issue? This is not, right? This might address their issue of chewing the fingers and not having the skin rubbed raw, but we didn't have the cue for that. Our cues are for anxiety and the non-use of the mittens. So don't pick A. Encourage physical activity such as ambulation. If they're in a high stress environment, if they're having anxiety, activity will get their mind off of biting their nails, and it'll get their mind on walking. So I would choose this. Provide frequent contacts for communication and socialization. Okay, I would choose this for their anxiety, right? If they're anxious, this is called diversion therapy, right? Frequent contacts for communication and socialization. They'll talk instead of chewing their fingers, right? Provide family education. Sure, I think I would choose this because their family and friends could be, if they are suffering from anxiety, their family and friends could be a good instrument to help them be calm, right? But the family cannot be helpful if they don't understand what they're supposed to do. So I would choose this. And encourage involvement of family and friends. I would also choose that. So my choices would be B, C, D, and E. Let's see if we're correct. And we are correct with our choices. Ask the client to rub lotion over the hands every day after bathing was not chosen, but all the rest of them were chosen. The reason being
the explanation says socialization and communication, in addition to increased activity, are all means to aid in the prevention of self-injury. Notice that I had something different. I used my cues to come up with solutions to not use the mittens and to decrease anxiety. But because I used the clinical judgment model, I was able to come up with the right answers.